Four types of complicated grief have been identified: chronic grief, delayed grief, masked grief, and exaggerated grief. Chronic grief is characterized by grief reactions that do not diminish over time and continue for an indefinite or very long period of time. Delayed grief is characterized by suppression of the grief reaction while the grieving person consciously or unconsciously avoids the pain that has occurred with the loss. Masked grief occurs when the behaviors of the survivor interfere with normal functioning, but that person is not aware that these behaviors are concealing the actual grieving process. Exaggerated grief occurs when the survivor is overwhelmed by grief and cannot function in daily life. In such instances, the affected person may use self-destructive behaviors, such as drugs or alcohol, as a coping mechanism. The potential for suicide with exaggerated grief cannot be overlooked by the healthcare team. Disenfranchised grief is experienced by a person whose relationship with the deceased person is not supported socially or is of less significance. P1092. Which cultural practice is commonly followed by Asian Americans during mourning? Select all that apply. 1. Some, or all responses may be correct. Displaying a memorial of the deceased at home. Head at home. In Asian American culture, a memorial is displayed at the home in memory of the deceased person. Asian Americans also show respect for the deceased person's body by providing warm clothes for the burial. Hindus prefer the cremation process. In African American culture, music and singing are commonly included during the mourning period to help people to handle grief and loss. After the funeral, African Americans may share a meal to provide emotional support to the family. P1090. Exciting new feature. Still have some questions or want to clarify the rationale? Exciting new feature. Still have some questions? Ask textbook assistant dismiss. Next. A nurse is caring for terminally ill patients in a hospice setting. The senior nurse explains Wharton's grief tasks model to the junior staff. According to Wharton's grief tasks model, it takes about a year to come to terms with the loss experienced. However, it may differ from person to person. Once the reality of the loss is accepted, the person may experience the pain of grief. It is manifested by loneliness, sadness, or despair. This stage is followed by adjustments to the world in which the deceased is missing. The family members may start performing roles of the deceased even if they don't like to. The final stage is to emotionally relocate the deceased and move on with life. Blocking the pain and denying the loss does not help with moving on. P1089. E-nurse has identified 3 nursing diagnoses for a patient who is having anxiety and hopelessness as a result of a loss. Which approach would the nurse take when prioritizing nursing diagnoses? Select all that apply. 1. Some, or all responses may be correct. Use family members and physician orders as primary resources for prioritizing actions. Address the nursing diagnosis that most affects the medical diagnosis. Ask the patient to identify the most distressing symptom and address that problem first. Use nursing knowledge to address the problem that is the underlying cause of other diagnoses. Focus first on the diagnosis that will be easiest to address. Confident, not sure. The nurse has identified 3 nursing diagnoses for a patient who is having anxiety and hopelessness as a result of a loss. Which approach would the nurse take when prioritizing nursing diagnoses? The nurse should include the patient when prioritizing nursing diagnoses. Asking the patient to identify the most distressing symptom allows the patient input into his or her health care. Some patients do not fully understand the physiology or relationship among diagnoses. For example, a patient may not understand that pain contributes to decreased appetite or depression. Nursing knowledge along with the patient's perceptions help the nurse determine the diagnosis with the highest priority. The patient should be the primary resource, not family members or the physician. The patient may be experiencing symptoms that are unrelated to the medical diagnosis. The nurse should focus on the symptom that the patient identifies as most distressing first, not the diagnosis that is easiest to address. Test taking. Tip: when you think you have finished selecting your answer, but before you go to the next question, double check whether the question is multiple response or single response. This will save you from choosing a correct response, moving to the next question, and missing that there were additional correct responses on the multiple response questions. P1096. Exciting new feature. Still have some questions or want to clarify the rationale? Example: would the nurse include to better explain this type of grief? Select all that apply. 1. Some, or all responses may be correct. Death of a pet. Confident, not sure. E of grief. Select all that apply. 1. Some, disenfranchised grief, also known as marginal or unsupported grief, is due to the loss of a person with whom the relationship may not meet the societal norms or is otherwise trivialized. Examples that illustrate this type of grief include the loss of a pet or the loss of an ex-spouse. Other examples of disenfranchised grief include the grief caused by the separation of a partner due to a prison sentence. ERS. Confident, not sure. A patient is diagnosed with breast cancer and expresses sadness and disappointment. The nurse would use which assessment activity when planning care for this patient? Select all that apply. 1. Some, or all responses may be correct. Observe her nonverbal behavior. Observe the relatives who visit her. Assess her economic background. Assess her response to care options. Observe her interactions with others. Confident, not sure. Nonverbal behavior like sadness and closed eyes may indicate grief. Observing the patient's responses to care options can offer clues about her feelings and hopelessness. Her interactions with others may reveal her lack of interest and unwillingness to meet others. Observing the patient's relatives may not contribute to planning care for the patient. Assessment of the patient's economic background may not indicate grief response. P1000. Nurse is explaining hospice care to the family members of a patient who has had a massive stroke. Which information would the nurse provide to the family members? Select all that apply. 1. Some, or all responses may be correct. Hospice is a place to care for terminally ill patients. Hospice is a program that provides care for terminally ill patients. Hospice manages the patient's pain and provides comfort. Hospice meets the economic needs of terminally ill patients. Hospice services are available at home as well as hospital settings. Confident, not sure. Hospice is a program and model for terminally ill patients. It seeks to provide comfort and manages the patient's pain. The services are available at home as well as in a hospital setting. Hospice is not a specific place for terminally ill patients, and hospice does not provide economic support. P1098. Exciting new feature. Still have some questions or want to. Why illness? Which intervention would the nurse include in the care plan for this patient? Select all that apply. 1. Some or all responses may be correct. Provide comfort. Discuss options for euthanasia. Preserve dignity and quality of life. Provide social support. The nursing care plan should focus on providing comfort and preserving dignity and quality of life for the dying patient. The patient should be allowed to spend the rest of his or her days in as much comfort and peace as possible given the patient's condition. The plan should also include providing social support to family members to prepare to grieve their loss. Euthanasia is a controversial issue, and nurses should not take part in that decision. The nurse should not provide economic support to the family members. Test taking. Tip. Do not select answers that contain exceptions to the general rule, controversial material, or degrading responses. For this question, the choice about euthanasia would be excluded from being a possible answer. P1000 and patient has passed away after a massive heart attack 5 days following hospitalization. Which nursing action is performed for the family to facilitate mourning? Select all that apply. 1. Some or all responses may be correct. Supporting the family's efforts to adjust to the loss. The nurse should provide support to the family to help them adjust to the loss of their family member by helping them accept the reality of loss. The family should be allowed to grieve, as it helps them come to terms with the loss. Use of alcohol for getting over the crisis is an ineffective way of coping and should be discouraged. The nurse should not try to rush the family through the grief process. Allow time for grieving and continuity of care. P1088. Exciting new feature. Still have some questions or want to clarify the rationale? Ask textbook assistant. Dismiss. Next. older adult has chronic body aches due to muscular dystrophy. The associated pain has put the patient in a state of hopelessness. Which nursing intervention would be helpful to this patient? Select all that apply. 1. Some or all responses may be correct. Treating the chronic pain. Setting appropriate goals. Treating the pain helps the patient gain hope. Setting up appropriate goals helps in prioritizing the problems, while matters of lesser importance will not receive much attention. An older adult with a debilitating disease will definitely require social support. Advising the patient to get a job may not be appropriate due to the patient's age, disease, and the associated pain. Heating pads can sometimes relieve pain, but are a temporary measure. P1091. Exciting new feature. Still have some questions or want to clarify the rationale? Ask textbook assistant dismiss. Next.
Well, folks, it's about that time. You guys want my thoughts on no coming back to face off against the new Venom, so let's get into it. I'm not even gonna lie, I feel like this whole issue is about a piece of bullshit. I mean, we already came into this run with a human teeth Venom. Then we find out that his brand new host that we've all been wondering who it is for the longest time possible is Mary Jane of all people. Then you're gonna tell me this brand new team up between the two of them now has to face off against one of the greatest threats the multiverse has ever known in just a few runs. This is not just some throwaway villain. This is the god of all symbiotes, the former King in Black. This is the same guy who pulled up on our side of the universe, came to our planet, and then took it over in less than like 5 minutes. The last time Venom had to fight this man on par, he had to be infused with the Enigma Force. Then on top of that, had to combine the power of Thor's hammer and the Silver Surfer's bull to make an all-new weapon just to fight him. And even after all that, he still had to throw his ass into the sun. So it took a seasoned Venom to have all those buffs just to defeat this man. What the hell is this version gonna do? I can just see them making this man goofy as hell to make this make sense. But what do you guys think? Folks, it's about that time. You guys want my thoughts on no coming back to face?
Which emotion or experience is common during Sheldon's pangs of grief stage? Select all that apply. 1. Some or all responses may be correct. Sadness. Sadness. According to Sheldon's theory, grief and loss include 4 stages: initial shock, pangs of grief, despair, and adjustment. During the pangs of grief stage, an individual experiences the pain of loss, which may result in sadness, insomnia, and social withdrawal. Numbness occurs in the initial stage of grief. After experiencing the pain of loss, the patient may try to adjust to the environment, which is the 5th stage. In the stage of despair, the patient may feel a loss of direction in life. P1089. Exciting new feature. Still have some questions or want to clarify the rationale? Ask textbook assistant dismiss. Next. While caring for a hospice patient, the nurse observes that the patient is experiencing nearing death awareness. Which sign might be observed by the nurse? Select all that apply. 1. Some or all correct answers were not selected. A patient experiencing nearing death awareness may communicate symbolically. Due to the fear of death, the patient may appear confused and make hand gestures such as reaching or appearing to hold an unseen object. Weakness and an inability to swallow are symptoms of a dying patient, but these do not indicate nearing death awareness. P1101. Exciting new feature. Still have some SS according to Sheldon's theory? Select all that apply. 1. Some or all responses may be correct. Shock. Of grief. Bargaining is a stage of grief as described by Kubler-Ross. Reorganization is the last stage of the Bowlby model of grief. Study tip. Sheldon's stages of grief can be abbreviated IPDA or his PGDA. Make up a sentence or question to help you recall the order, such as is Paige doing anything for Sheldon? Because you are studying more than one theory about stages of grief, you may wish to include the name of the theorist in your sentence. P1089. Exciting new feature. Still have some questions or want to clarify the rationale? A nurse is caring for a terminally ill patient. Which physical change in the patient suggests that death is near? Select all that apply. 1. Some or all responses may be correct. Decreased oral intake. Aspiratory congestion or the death rattle from the inability to swallow secretions also are common manifestations of impending death. Test taking. Tip. Knowing that the body systems slow down as the patient approaches death is the key to this question's response. When evaluating questions like this one, ask yourself whether each choice is an increase in function or a decrease in function for that particular system. Both of the incorrect choices, increased urine output and decreased periods of sleeping, reflect an increase in function, one for the urinary system and the other for the nervous system. The correct choices reflect decreased function, consistent with the patient being near death. P1101. Exciting new feature. Still have some questions or want to clarify the rationale? Which intervention would the nurse implement to provide a supportive environment for a dying patient? Select all that apply. 1. Some or all responses may be correct. Instruct the family to not bring any pets in to visit. Provide privacy while the family is with the patient. Allow the patient to have photographs in his or her room. Allow the family to visit only during the visiting hours. Provide an environment with input from the patient. Confident, not sure. A nurse works with patients in a psychiatric clinic. Which condition may cause disenfranchised grief in patients? Select all that apply. 1. Some or all responses may be correct. Death of a sibling. Death of a pet. Disenfranchised grief is encountered when a loss happens that cannot be openly acknowledged or publicly shared by the grieving person. It occurs when society does not want to acknowledge the grief. Examples are the death of a pet, ex-spouse, or stillborn baby. Losing a parent or sibling are not examples of disenfranchised grief, as these are validated and recognized examples of loss. P1093. Exciting new feature. Still have some questions or want to clarify the rationale. Information will the nurse provide to educate the patient about anticipatory grief and its management? Select all that apply. Which, a patient is upset due to the terminal illness of his parent. Which information will the nurse provide to educate the patient about anticipatory grief and its management? Select all that apply. 1. Some, or all responses may be correct. Emphasize high-dose sedation. Instruct the patient to avoid meeting his parents to overcome grief. Explain to the patient that grief may aggravate his situation. Explain to the patient that he will eventually become mentally prepared for the loss. Explain that his grief cannot be controlled by willpower, as it is an unconscious process. Confident, not sure. A patient is upset due to the terminal illness of his parent. Which information will the nurse provide to educate the patient about anticipatory grief and its management? Select all that apply. 1. Some, or all responses may be correct. Emphasize high-dose sedation. Instruct the patient to avoid meeting his parents to overcome grief. Explain to the patient that grief may aggravate his situation. ND only for severe grief. Since it is a terminal illness of a parent, the patient will eventually prepare for the inevitability that the parent will die. Grief cannot be controlled by willpower, as it is an unconscious process. High-dose sedation should be advised only after obtaining the healthcare provider's opinion and only for severe grief. Avoiding his parents is not a justifiable way of escaping grief. Religion. Assessing family support helps the nurse understand whether the patient would be able to cope with the loss. The patient may exhibit behaviors indicating a grief response. The nurse should be watchful for a negative response. It is important to understand the patient's loss from their point of view to know the significance of the loss. The patient's religion and culture also affect the patient's coping, however, their assessment is less important after loss of a body part and more important during death. P1087. Exciting new feature. Still have some questions or want to clarify the rationale? Ask textbook assistant dismiss. Next. patient is being evaluated in the emergency room with a complaint of gasping for breath. Despite receiving basic life support measures, the patient expires. Which action does the nurse take in providing post-mortem care? Select all that apply. 1. Some or all responses may be correct. Follow through with any organ donation arrangements. Clean any soiled areas of the body and apply a clean gown. Elevate the feet to prevent facial discoloration. Accommodate the family's religious wishes, if possible. Remove tubes and indwelling lines if an autopsy is requested. Confident, not sure. The nurse should follow through with any organ donation arrangements and ensure adherence to institutional and state policy and procedures. The nurse should also clean any soiled areas on the body. A full bath is not necessary, and then apply a clean gown. Accommodation of the family's religious wishes should be made, if possible. To prevent facial discoloration, the head should be elevated, not the feet. The tubes and indwelling lines should be retained if an autopsy is requested. Test-taking tip: avoid looking for an answer pattern or code. There may be times when 4 or 5 consecutive questions have the same letter or number for the correct answer. P1103. Exciting new feature. Still have some questions or want to clarify the rationale? Which intervention will the nurse implement in the care plan for a patient who is grieving the loss of a loved one? Select all that apply. 1. Some or all responses may be correct. Encourage the patient to include exercise. Instruct the patient to consume a healthy diet. Provide hope for the patient's remaining life. Limit the time for visitors to see the patient. Provide education about the stages of grief. Confident, not sure. Which intervention will the nurse implement in the care plan for a patient who is grieving the loss of a loved one? Select all that apply. 1. Some or all responses may be correct. A grieving patient may be unable to accept the truth about the loss of a loved one. The nurse encourages the grieving patient to include healthy behaviors such as exercise because it will help relieve stress. The nurse encourages the patient to consume a healthy diet to maintain normal metabolism. The nurse also provides education about the stages of grief, as it may help the grieving patient accept the truth and prevent complicated grief. The nurse does not give the patient false assurances about his or her life because it may lead the patient to lose trust in the nurse. The nurse does not limit the time for visiting the patient because it may increase the grieving patient's anxiety. After assessment, the nurse finds that a patient is near death. Which finding led the nurse to this conclusion? Select all that apply. 1. Some or all responses may be correct. Hearing the death rattle. ASE of urine due to loss of control over the muscles also occurs after death. Study tip. Another tool to help you study is to imagine that you are the instructor and try to compose questions from the material presented. Would you have asked students to recognize assessment findings that indicate a patient is near death? As the patient approaches death, he or she may lose the ability to swallow and may have an increased production of bronchial secretions. This results in the accumulation of secretions in the throat and chest. It produces a sound that is called a death rattle. In this stage, metabolic changes occur in the body, and urine output decreases. In addition, inadequate pumping of blood occurs, which results in decreased blood pressure. The skin becomes pale and bluish due to blood settling after death occurs. An involuntary release of urine due to loss of control over the muscles also occurs after death. Study tip. A patient is diagnosed with advanced leukemia and is hopeless about the treatment. Which nursing intervention would help the patient overcome hopelessness? Select all that apply. 1. Some, or all responses may be correct. Treat chronic pain. Advise dietary modification. Provide economic support. Identify sources of social support. Provide opportunities to express positive life events. Confident, not sure. Treatment of pain can make the patient more comfortable and help in building a positive outlook. Family members, friends, and support groups can be approached for help. Providing opportunities to express positive life events helps the patient focus on positivity rather than negativity related to the disease. Guess. Are you experiencing increased? Which? A patient with prostate cancer has undergone prostatectomy and is on chemotherapy. Which question would the nurse ask when assessing the psychosocial health of the patient? Select all that apply. 1. Some, or all responses may be correct. How do you feel about the cancer? Have you experienced any sexual changes? Are you experiencing increased fatigue because of the cancer? On a scale of 0 to 10, how do you rate your distress? Confident, not sure. Sing the psychosocial health of the patient. Select all that apply. 1. Cancer and its treatment affect the patient on all spheres: physical, mental, and emotional. Asking the patient how he feels about his cancer is a good example of an open-ended question. It gives the patient an opportunity to explore his emotional sphere completely. By asking the patient to rate his distress, the nurse can assess its severity. Asking about how the family is coping helps the nurse evaluate the coping skills of the family and the patient. Asking if the patient is experiencing any sexual changes is part of the sexual assessment of the patient, not the psychosocial assessment. Similarly, asking if the patient is experiencing increased fatigue is a